veterans returning home from war. The battle is far from over. They struggle with issues of loss, grief, and transitioning to civilian life. And without proper care, the consequences can be devastating. Depression, substance abuse, even suicide. My guest today advocates an innovative method for breaking that tragic cycle: art therapy. Heidi Bardot is an assistant professor of art therapy and the director of the Columbian College's art therapy program. As she explains, art therapy has shown promise in helping wounded warriors cope with the repercussions of combat-related trauma. Heidi, thank you so much for being here with us today to talk about this incredible field.
Sure.
I must ask, art therapy, of course, is a well-regarded field in many quarters and has an incredible tradition, even a philosophical aspect to it. However, has art therapy received the attention that it deserves in the healthcare profession?
It's an interesting question because art therapy has actually been around for quite a while. It started right after World War I, ironically, in response to soldiers coming home from the war and having to deal with shell shock. So in some ways we've come full circle now that we're back working with veterans again with all of the recent chaos in the world. So there are certainly areas of art therapy that are very well respected because we know it works. However, like many other mental health professions, we have to prove to others that it works. So that's where we're starting to do research and find ways to show the public how important it is and the fact that we believe it's one of the key ways to work with veterans and work with trauma.
This is a very interesting trajectory for the overall field. At GW, since one of our signatures in the art therapy program really has to deal with trauma sufferers, I just wanted to have a chance to ask you a little bit more about this and how we radiate our specialty. What makes us distinct?
One of the distinct aspects of our program is the trauma work. We realized pretty early on that everyone has some sort of trauma, whether it's a large trauma like abuse or neglect or war, or whether it's a small trauma with possible less negative results, such as a divorce or a car accident. But everybody is bringing some sort of trauma into their present lives. So we recognize that art therapy is a key way to deal with some of those aspects, and we wanted our students to feel effective when they went out to work with clients, that they would be approached with this idea of trauma no matter who they were working with, no matter what population, what age. So we decided we needed to have a huge component of our program focus on the trauma work. So our students have a full year of very specific trauma-related art therapy, and then also work in the clinic, the GW Art Therapy Clinic, working with specifically trauma clients.
So based on this, what is it that is so unique about art therapy in dealing with trauma?
Well, one of the aspects of trauma is that trauma is stored, we've discovered this through neuropsychology and looking at the brain images, that trauma is actually stored visually. And we call it flashbulb moments. So, for instance, if you think of even a small trauma, such as a car accident that you've had, you will actually remember that trauma in brief flashbulb moments. It's rarely a continuous memory. And if you have a larger trauma, such as with war or with abuse, those are even more distinct. And so these memories are stored visually. So we believe that the way then to access them is visually, because again, similar to having a dream. You have this amazing, vivid dream, and it's very clear to you, there's emotional content, and you wake up and you try to tell someone about this dream, and it just slips away, or the words just aren't there to express how incredible it was. And it's the same with trauma. Sometimes there just are not the words to connect to that memory. So to describe what it felt like to be in that moment, to feel the helplessness, the hopelessness, is almost impossible to connect those words with the images. However, with art therapy, we allow the person to not have to do that, at least initially. They can create a color or a shape or an image or something that promotes that feeling of what that memory was. And then afterwards, you separate from it and you connect the words to describing what that image is. The second aspect of that is trauma works with art therapy because it gives that little bit of distance. So where it might be difficult to say to someone, describe what that was like, there's an inherent fear of getting into that moment and reliving that moment. However, if they're describing this image they've created, it gives that bit of objective separation from it, and it's a little bit easier, safety-wise and threatening-wise, to talk about that image rather than this is what I experienced. So it gives, one, that visual connection, and two, that separation.
Wow, so it seems like one of the important things about art therapy is also how it unfolds gradually, so that's part of the catharsis that takes place. It seems also that at this particular moment in time, given that we've got so many veterans returning home from war, art therapy has a particular niche in really addressing the trauma that such individuals have dealt with. And I was wondering if you could speak to this a little bit.
It's true. We actually have quite a few art therapists that are involved in some of the local military organizations, so at NICO and Walter Reed, and we have interns there and art therapists there, and they're finding that it seems to be one of the key ways that allows that person to go back and deal with those memories, like I said, in a safe way, but also to do it in a way that really explores the emotional content. Because much of what veterans talk about is this, it's hard to describe, but kind of a soul wound, where there's nothing visually wrong with them in some cases, but there's this feeling of something inside being broken or something inside being wounded in a way that is hard to describe to others. Oftentimes when I've talked to veterans, they talk about how they return and people don't understand their experience. They've gone off to war, they've experienced these horrors, they've maybe done some things that they feel are going against humanity, or going against even the golden rule of do not harm others. How do you deal with that? You're in a life and death situation and you're being asked to make split-second decisions. So coming back, how do they reintegrate and how do they resolve that wound that they have inside that the average person doesn't even know exists if it's not physical? And art therapy allows them to approach that in such a way that, like you said, it is gradual. They can do a little bit and then step back. They can delve deeper and explore it to a greater extent, or again, they can step back when they need to. It's very much a process of kind of going in and out and in and out. And it helps in terms of just art in itself is healing. We have a belief that not only do we believe there are messages within the artwork and ways to address the unconscious, if you will call it that, but also that the act of creating the art and telling the story is healing in and of itself.
One of the things that I find most exciting about our art therapy program is how it really prepares our students for entering the professional realm. And I was wondering if you could talk to us a little bit about that experience and how we do that here at GW.
Well, and that's actually one thing I love about our program is that we are training our students to be professional, clinical art therapists, meaning they're not arts and crafts people. They are actually clinically trained to deal with these deep, dark wounds that people have and to do it in a healthy way. One of the trainings, obviously, is through our clinic, the community clinic. And in that clinic, students are actually working with a client with trauma, and the sessions are all videotaped and it's split screen so they can analyze the client and their responses as well as their own responses. And we have them go through that process of writing down the behaviors, the verbalizations, what are they thinking? Could I have done something better? Could I do it in a different way? Why didn't I do this? And we've found that by going through this process, they have turned from students into clinicians. And to watch that process is pretty amazing to see that within our 2-year program, they come in young, excited, and they come out these professional clinicians that I'm excited to send out and feel that they're really prepared to work with any diagnosis, to work with any age, and to feel that they really represent GW well. So I really feel confident in our program. I think we're one of the best programs in the United States, and I really believe strongly in our graduates. We had a recent graduate who went on an interview, and when the interviewer found out she was from GW, she said, "Oh, I don't need to check your references. We know you're great." And just that feels really rewarding, to know that our students are prepared to work with any client.
Heidi, thank you so much for really illuminating an incredible world for us, and really talking about the intervention that art therapy can make in human lives.
Thank you.